How does TMS treat bipolar depression? How does transcranial magnetic stimulation, or TMS, treat bipolar depression? This innovative therapy uses magnetic pulses to stimulate specific areas of the brain that play a key role in mood regulation. One of the primary targets is the left dorsolateral prefrontal cortex, which is often underactive during depressive episodes. By modulating the brain's activity, TMS can help alleviate symptoms, especially when traditional treatments like medications are not enough. During a TMS session, a magnetic coil is placed near the scalp. This coil generates brief magnetic pulses that pass through the skull and induce small electrical currents in targeted brain regions. These currents can influence how neurons communicate and may promote neuroplasticity, which is the brain's ability to reorganize and form new connections. In the context of bipolar depression, this stimulation can help restore balance in the brain networks responsible for mood and emotional processing. The underlying mechanism of TMS involves processes similar to long-term potentiation and long-term depression of synaptic strength. These processes are crucial for learning and memory. Additionally, TMS may increase levels of neurotrophic factors like brain-derived neurotrophic factor, which supports the survival and growth of neurons. This could contribute to improvements in mood and overall mental health. Clinically, high-frequency TMS, typically around 10 Hz, is commonly applied to the left dorsolateral prefrontal cortex. This approach increases cortical excitability in a region that is often less active during depressive states. In contrast, low-frequency TMS decreases excitability. Research indicates that high-frequency TMS combined with mood stabilizers can be effective and safe for treating bipolar depression. Many patients experience significant improvements without triggering manic episodes. Studies comparing TMS effects in bipolar and unipolar depression show that patients with bipolar disorder respond similarly to TMS treatment. Some evidence even suggests that TMS may reduce specific symptoms, such as paranoia, more effectively in bipolar depression. However, the research base for bipolar depression is smaller and less definitive than for unipolar depression, which is why TMS is often considered an adjunctive treatment rather than a standalone option. In practice, TMS treatment for bipolar depression typically involves multiple sessions over several weeks, with each session lasting about 30 to 40 minutes. This therapy does not require anesthesia and has fewer side effects compared to electroconvulsive therapy. This makes TMS a valuable option for patients who have not responded well to medications or who cannot tolerate their side effects. Because bipolar disorder is complex and involves mood fluctuations, TMS is usually used alongside mood stabilizers. This combination helps reduce the risk of triggering manic or hypomanic episodes. It is crucial for healthcare professionals to create personalized treatment plans to ensure safety and effectiveness. In summary, TMS treats bipolar depression by non-invasively stimulating brain areas that regulate mood. It promotes neuroplastic changes and can improve depressive symptoms, particularly in cases resistant to other treatments. TMS is a scientifically supported, FDA-approved therapy for major depressive disorder and is increasingly recognized as an adjunctive option for bipolar depression under careful medical supervision. Always consult with healthcare professionals for personalized advice and treatment options.